So without further ado, we will get started. I actually will be kind of in and out, but we will have our wonderful leaders from JEDI actually taking over and getting this webinar started. So thank you everyone for joining the AEM JEDI section's mentorship webinar. Tonight we will be discussing application tips for those applying into emergency medicine, with a flair for tips for those who are underrepresented in medicine, whether that be a sexual or gender minority, a racial or ethnic minority, or any other minority status. Obviously, I know everyone saw yesterday's election and may be feeling all the feelings from that. Obviously, we do not need to know who you voted for, but if anything that we mentioned today is triggering or you feel like it is upsetting, please feel free to log off from the call, and you can always contact us at our JEDI email. I will leave my personal email in the chat box. In addition, we have three wonderful JEDI leaders tonight who will be leading this session. So we have fourth-year medical student Javon Henry. We also have fourth-year medical student Shantae Williams, and also Dr. Jordan Vaughn, who is program leadership down in New Orleans. So without further ado, we will go ahead and start the webinar. Shantae?
Hello, everyone. Good evening. Sorry for the delay. I would love to introduce all of our panelists here. So I don't butcher anyone's names. Please go ahead and tell us about yourself. Where did you go to med school? Where are you training now? And your preferred pronouns so that we address you correctly.
I can go first. Hi, everyone. So my name is Brianna Williams. I am a PGY1 here at UT Houston in emergency medicine. I went to school in Florida at the Bradenton, Florida campus of Lake Erie College of Osteopathic Medicine. So I'm a proud DO. And my preferred pronouns are she and her.
I can go next. My name's Hassan. I grew up in Minnesota, went to medical school, undergrad at the University of Minnesota. For residency, I went a couple states over to Illinois, now PGY1 at U Chicago.
I can go next. Hi, everyone. I'm Kelsey Newbold. My pronouns are she, her. I went to medical school at Arizona College of Osteopathic Medicine in Phoenix and stayed for residency. I'm at what's now Creighton of Phoenix, formerly Maricopa County. I'm an intern there for EM.
Good evening, everyone. My name is Sean Gibson. I'm a second year emergency medicine resident at Kings County, SUNY Downstate in Brooklyn, New York. I attended the University of Buffalo Jacobs School of Medicine for medical school. My pronouns are he and his.
Nice. It's amazing to have you all here. Thank you so much.
Just to get actually started with the Q&A, I know we're having a discussion about interviewing, but can you just tell us a little bit more about your application and what you felt as though was the most valuable aspect of your residency application?
Yeah, I can go first. So I think for me, I think the personal statement is really your one chance to speak your story and tell your story in your own words. I know a lot of people use a lot of people to revise their personal statements, but I would just be very cautious about that. It does change your voice a lot, and having a lot of different voices, like some people will like do the intro and some will like fix the final paragraph. Just be very careful because it is your voice, it's your story, it's your chance to really showcase who you are and why EM is important to you, who you are as a person, your values. And I think that was the highlight, that in almost every single one of my interviews, they talked about my personal statement or something that I mentioned in there. So I think that was a really important piece of my application.
I think this is a great question. I personally noticed that the things that I got asked a lot about on interview day were things that honestly surprised me. I thought that people would ask me about my research or like all the grinding that I did or extracurriculars, but no, people ask me about the random hobbies that I put on my applications or the fact that I spent literally like 1 week in rural Minnesota for a rural medicine rotation. Like that 1 week of my life ended up being so much of interview season. So I think people really they want to know who you are behind all of the grinding that everyone has to do in medical school. And I really enjoyed the aspect of our profession and the questions that we get on interview day. But yeah, it was cool to get to be a person beyond being a medical student.
I would definitely agree with what was said. I think the personal statement is your chance to show your voice and show who you are, what's important to you. One thing I got asked a lot in interview season was like, what's one thing that you're proud of on your application? So I think that's an opportunity to really talk about something that you're proud of that you did in medical school, and really show your voice that way. So I think that was one thing that I didn't expect to get asked that I got asked a lot about. And then you can kind of talk to what's important to you and what you value. And I think that speaks a lot about you as an applicant.
Perfect. Thank you guys so much. Sean, I don't know if you wanted to weigh in on that as well.
I'll just wait.
Okay.
Yeah, I think
That's
we
fine. It's
we
fine.
gave responses. We'll just march on through. Yeah.
No problem. Okay, so our next question actually comes from a registered participant. And the question is, what do you feel, sorry, was the most valuable aspect of your residency application?
Sorry, Shantae, I believe you had the next question after.
Oh, I'm doing both of them, the one below with the participants and then mixing it in with the regular ones.
Sorry, Shantae, can you repeat the question?
Sure, I'm sorry, guys. So let's restart. So the question was, what do you feel was the most valuable aspect of your residency application?
Yeah, I think to be able to like highlight the top 3 experiences that you put, is you list out all of the activities, everything that, the top, I think it was top 10, experiences that you had during med school and in your journey. And then it's like label your top 3 and why and elaborate. I think that was a big factor for me, to be able to really showcase like, okay, yeah, I can really explain why this was affecting me as my character, and how it's going to make me a better physician in the future. And I think that was the biggest thing that stood out.
I remember when I was filling out my application, I kind of did all of my training or medical school, undergrad, whatever, in Minnesota. So I really wanted to leave the Midwest, and I did 2 away rotations, one on the East Coast, one on the West Coast. And I was like, okay, like I'm gonna figure out which coast I like the most. I'm gonna keep my geographic limitations to none because I want to get out of here. And then throughout application season, I mean, obviously I ended up in the Midwest. I ended up loving U Chicago, but I guess initially for me, I really wanted to just explore all of the whole entire country. I just wanted to end up at whatever program that I felt would be the best fit and give me the best training. But throughout the process of interviewing, I was like, well, I actually really do love the Midwest and I do want to stay close to my people. And, this program really appeals to me. So I think that was just where my brain was um, going into application season.
I think kind of like Brie mentioned about like your top 3 activities or extracurriculars, I think just focusing your application on things that are important to you, things you value that really like show yourself as an applicant and what you can bring to a program is the most important, whether that's through a personal statement, through your activities. I wouldn't stress too much about like putting in all this research and all these things that you think is going to be maybe impressive. I think in the EM world, a lot of people really don't care about a lot of those things. They just want to make sure you're a cool, decent human being that they want to hang out with. And so really focusing on things that you have interest in, that you can talk about, that you're passionate about. I think that goes a really long way in EM versus maybe some other specialties that care more about your publications and research. If you have all that, that's great. If that's your passion, that's great. But I wouldn't stress too much about those things, and then just focus on what you're passionate about, and that'll go a long way in interview season.
Great answers from all the other panelists. I really do want to highlight, pardon me, just the fact where with the hobbies and on interview day, actually knowing yourself, right? Like everyone knows a whole ordeal with, hey, research, let's get the personal statement in. But when you're in an interview and you're in front of this person, looking in the webcam, can you really tell the person everything about yourself without looking at your application, right? Like, what are your hobbies? As everyone said, with emergency medicine, which is one of the best specialties, we just want to make sure that you're a person that we would want to work with on shift, right? So you should know about yourself. What are your hobbies? You shouldn't have to ask yourself like, what exactly are they, or look at your application to just, genuinely answer that. So, don't really put too much hindsight onto your personal statement and trying to perfect it so much with it word by word. I mean, at this point, it's already too late. Everyone's probably interviewing right now. Just truly know yourself, and your application will show. It already showed for you to get the interview. I just want to highlight that the interview is probably more important than at this point right now with the application.
Nice, all great answers. And then the next question that we have from the registrations is how to reach out to programs if your application has an important addition to it. So whether that be a updated SLO or updated Step 2 score, how would you recommend reaching out to programs?
I think that's the beauty with knowing the clerkship, pardon me, not the clerkship, the residency coordinator. You don't necessarily have to email the program director. Throughout this cycle, I hope you all really know that the residency coordinators are really the wheel behind all of this madness. So please be nice to everyone, as usual, just to be a good human, right? But understanding that the program directors and the APDs are, the leaders, but everyone a part of that team is equally important. But the residency coordinators are the individuals that I personally reach out to if I had like an updated SLO or just anything during my time.
All right, if no one else wants to chime in on that question, our next question is a little touchy. So how do you overcome something like a failure of, let's say, step 1 or the complex 1 or a low step 2 score? How does that affect you in the interviews, and how do you kind of like wing it to spin it in your favor?
Yeah, I mean, for me, I was definitely an average med student. I was definitely middle of the pack. My scores were always around average, but on step 2, it was a little lower than I expected. But I think the beauty of EM, I think someone mentioned earlier, is that, they really want to know, are you just are you a cool person? Are you really interested in this specialty? You're more than a score. And I think having a lot of experiences, a lot of leadership experiences, being able to like showcase that is like something that you can definitely talk about in your application or in the interviews when they ask you. But always like what have you like learned from this experience? Is there something that you would have done differently? Was there a reason why? Or is, versus just harping on like, oh, I did this and, it's the universe's fault. explain and really be able to say, like, I learned, that I should have done this. I should have studied better. I should have prepared. I just wasn't managing my time. But I've learned by using a planner now that this is what I've done moving forward, especially if it's step 1 versus step 2. Then you can really show them, like, this is how I've progressed. This is what I've learned. And that can show that you are resilient, and really, using those kind of themes to help show how you are as a human being.
I really love that answer. I would add that, residency is all about failures. Every day I wake up, I fail, and I go back home and do it all again over and over and over again. And failure is not a bad thing. It's just part of life. It is simply part of our trajectories and our stories. And I think that is beautiful. It's not just something that is, okay, it is actually beautiful. And you just have to morph that difficult time into a lesson and come out of it all the stronger. For me, step 1 was like so mentally rough. Like, it was the first year that was pass fail, and luckily I passed, but I have like never been through like such mental agony in my life. So even though on the outside, like, there wasn't fail on my application, like in my life, I felt like I failed. I felt like I failed myself. I felt like my mental health was in shambles. And I learned a lot from it. And then the only other thing I would add is, actually, I forgot, so sorry.
I think that was all like very well said. One thing I would remember too is if you got an interview, then have some, confidence in yourself that there was something in your application that program liked, or else you wouldn't be at the interview stage. So I think at that point, the test scores, the bad grade, whatever it is, probably doesn't matter all that much once you get to the interview stage. They really just want to know you as a person. And so, they might ask about it, and like they both said, that's your opportunity to kind of, show resilience. And residency is about failing every day. Something is not going to go well, and you have to bounce back from that. So I think it is an opportunity to show resilience, and also just try to just take a deep breath and know if you got an interview that they saw something that they liked. And from there on out, it's just about who you are as a person, and that number on a piece of paper is completely irrelevant at that point.
Thank you guys so much. Those responses were very heartfelt and genuine. Yeah, so someone in the chat asked about failure, but I'm gonna let my co-host go ahead with that one.
Yes, so for this particular question, it basically asks, how would you go about explaining a failed step? So I'm presuming that they're talking specifically when you get to that interview stage. How would you explain a failed step? And then I guess I can even broaden it out to how would you explain like a failed clerkship or anything of that nature that might be a misstep on your application?
I could start off with, oh, sorry, Bree, you've been answering the questions first all the time, so I figured we'll just change a pot a bit. I think, honestly, at that point, you just need to be genuine and honest with that interviewer, right? And I just also want to say, like, let's also change the narrative. Let's start embracing your failures, and then showing how you actually got better through those failures, and how you will do in the future, because we still have to take step 3. Program directors want to make sure you're able to pass that. That is the right time to say, hey, I failed XYZ because of ABC. This is how I adjust 1, 2, 3 to get this passed, and this is how I'm going to go through it moving forward when I have future board exams, right? That shows that you're acknowledging your failures, you processed it, you found a way to fix it, and this is how you're going to apply it in the future, so that you don't have to think about me as that struggling resident, that needs to have a difficult time passing boards, right? That action and that action plan says a lot. So that's one way I would answer that question about going across failed clerkships or step scores or anything of that sort.
Okay, thank you for that answer, sir. Very insightful and helpful for the audience, of course. And if no one else has any additional thing to add to it, I guess the next question would be, should you apply to a program even if you don't meet their prerequisite step or COMLEX score?
I'm going to say absolutely, because one thing that I noticed on my interview trail is a lot of times those websites are outdated. So they might say that only STEP is accepted, but then when you actually email the coordinators, you're like, oh no, we actually do take STEP and COMLEX score. So you shoot your shot, because you never know if the website that you're getting all this information is outdated. And even still, you're more than a number. Like, let them tell you no. Don't tell yourself no. Like, you worked hard through med school. You've earned this spot. You are going to be an amazing physician. Shoot your shot. Do not stop and just say, oh, I'm too scared. I understand, like, financially, you are spending the money on a program, but you never know.
I think that was great. I think Bree answered for everyone. There was a lot of enthusiasm and I loved it. So moving on to our next question, which is perfect because it segues for a group that does feel a little inadequate when they are going through the interview process. And I'm talking about IMGs, US IMGs, non-US IMGs, and Bree applicants. So do you guys have any tips for these special groups that are going through this process? How do they kind of stand out, amongst their peers in this situation? Don't
So
all jump at once, guys.
I'm gonna jump right now,
Okay, good job, Sean.
So I actually have a lot of co-residents who are US IMGs. And those are probably one of the most hard working residents in our whole program. I feel like everyone, no matter what you are going through, may have some type of imposter syndrome, whether it's, you feel inadequate within your race, your gender, where you went to school, whether you're an MD or DO. But at the end of the day, everyone works hard. Everyone's at the program for a specific reason. Everyone got the interview for a reason. You should trust yourself with that. So with my co-residents personally, a lot of them had to rotate at different hospitals, and I think that's the beauty within emergency medicine, not necessarily just only board scores, where you rotate and your evaluations from your SLOE and how you are on shift. Like, that says a lot. So to pretty much sum it up, I think if you really worked hard throughout your third or fourth year, you have good letter of evaluations, you're doing well with the boards and just passing and whatnot. If there's a program that you're interested in, and I had a lot of co-residents that didn't initially get the interview to Kings County when the October 20th date first came out. But then, you'll realize throughout the interview cycles, you'll get some interviews from some programs. So just keep your head up and know that you're great and greatness is going to happen. Just be patient with it, but trust your gut.
That was a great answer, Sean. I definitely agree. I think just to piggyback off that, I think, again, shoot your shot. Even as IMG DOs, there was quite a few programs that had not matched DOs, or very low amounts of DOs, that I still reached out to, expressed interest that I wanted to be there. Even at the program that I'm at now, I did not get the invite originally when October 1st released all my interviews. Around Thanksgiving, I was like, let me just send a letter of interest to still express that if there was any openings, I would still love to take an interview, because I really did love this program. And a few weeks later, I did hear back and got an interview and ended up ranking as #1 and matched here. So I highly recommend, shoot your shot. If that's not the theme that I'm going to always preach, just shoot your shot.
Okay, and does anyone else have anything else to say, or can I move on to the next question? Okay, perfect. So now that we shot our shot and we've received an interview invite, what are some general tips that we can use to prepare for the interviews?
So I will echo what Sean said earlier, but know yourself. There are some questions that come up over and over and over again, like, tell me about yourself. And I hate that because, like, how do you summarize everything about yourself in like one or two succinct sentences? But that's what you have to do. You just have to figure out your summary and practice it. Practice it in a mirror. What I did was I just had this really long Google Doc that I had all these list of questions that from whatever resource, I don't remember, of interview questions, possible interview questions. And I typed out my answer to every single one of them. And before every single interview, I just glanced over all of my answers just to remind myself, like, if I get asked about this, you know, these are the points I want to make. If I get asked about XYZ, I want to make these points. But I would not read off of that document on interview day because at that point it would have felt too artificial to me. I think in addition to that, I also utilize Chat GPT to help me come up with questions that I might be asked or help me kind of think of a way to summarize myself. So use your technology, use your resources, and just practice. Read over your answers. Like talk it out loud. Say the words out loud, even if it feels funky or weird to do that, like in a mirror. But you do want to come off as polished, and you also want to come off as someone who is self-assured and who's thought about not just why you're applying to this specific program or this specialty, but why do you even want to be an emergency medicine doctor? What are your long-term plans? What's your like plan 10 years down the road? Like, why are you choosing this specialty in order to achieve those goals?
I agree. I think that was great advice. I would definitely have just a few, whether it's experiences or stories or something kind of in your back pocket that if you get a question, you can kind of pull from your experiences and talk about those things, whether that's like creating a document, or just kind of, you know, jotting things down in your phone and looking over it, whatever works for you, definitely using your resources. And I think just be confident in yourself and be genuine. I think that's the best you can do. If you sound too rehearsed or it comes off too artificial, interviewers can definitely see through that. So just try to be calm, be yourself, be confident, know that you got an interview because they liked something in your application, and go from there.
I would also add, please have questions for them as well too, right? Like, no, it's a two-way street. I feel like with interviews, MS4s and just in general, we forget that we're also interviewing the program as well too. Like it has to be a good match. Let's not give all the programs all the power. You all worked hard throughout your 4 years. You deserve to be at a program that you're going to thrive in, that you're going to, you know, struggle in, failures, as we said, but you want to be the best EM doc that you want to be possible. And you need to find that right program and home. So you shouldn't feel afraid to ask questions to anyone. So what I actually did, I had the same document that everyone has just said, but then I had questions specifically for residents because you're going to have an interview session with residents. And then you have questions for the program leadership. And I'll give one cool gem. One question that I asked the program directors, the residents, was, can you please, in 3 words, describe your program director? That's a good question because it already shows like, okay, if this person's able to give you 3 qualities about their PDs within 5 seconds, then you know that, okay, this is pretty much a good supportive program, that the PD is always there, you know, so take that for how you gauge it. But pretty much just to sum it up, have the questions for the programs, have the questions for the residents. These are going to be your future senior residents that you're going to learn how to do an LP tool or how to intubate. So you want to feel comfortable being there. These are the attendants, APDs that's going to be there to mold you into the doctor that you want to be. So remember, don't just think that they're just only asking you questions, ask them as well too.
I cannot, emphasize that enough, Sean. Thank you for bringing that up. I tell everyone going through this that like this is definitely a two-way street. I think as a fourth year med student, you're just so focused on trying to get the programs to like you, but it has to be a match just as much the other way. So asking those hard questions, even if they might be uncomfortable, I think especially as people who are underrepresented in medicine, sometimes those conversations are hard. I know for me, asking questions about programs like DEI, curriculum, things like that, especially in maybe more conservative states where there's legal like loopholes and things you have to jump through. Those were hard questions to ask, but it was really important to me to go to a program that accepted me for who I was, that valued the things I value. And so even though those are, questions that have political and all these different implications, I think it's really important to ask those hard questions because you want to feel comfortable where you're at just as much as you want a program to like you.
Thank you so much, guys. So our next question is, should I turn down interview invites for programs I'm not interested in? Obviously, in the beginning you get excited and you're applying to about 100. And then as it goes on, you kind of lose interest. Should you turn them down or should you still hoard them?
I definitely think turn them down. I turned down quite a few that I was like, oh, I only applied here because I needed to, from my advisors told me to kind of fluff my interview or like my chances of matching. And then when I started getting interviews, I was like, wait, I really don't see myself living in this city. Like I would actually not enjoy my life if I did. And that was things I had to like continue to revise, like what are important to me after like listening to other applicants ask their questions. It's like, oh, I didn't even think I should be thinking about this when I'm thinking about programs like that list or those like top 5 things on what's important to you as an applicant, you need to continue revisiting that because if that has shifted at all and some of these programs that you have interviews for do not align, then what's the point of having that interview? It's only, you're going to get fatigued by December. Oh, I was so tired of smiling on camera and just having those conversations, that's answering those same questions. And for me to have to do that to a program that I really don't care if I would go there for it, it's not fair for anyone else that really wanted to be at that place. And it's not fair to myself just with my time. So I think definitely turn it down for sure.
I think there is a number that they say. I think it's like 12. If you rank 12 programs or 11 or something, then you're basically like guaranteed to match. If I was someone who just wanted to do the bare minimum, I wanted to be very, very intentional about how many programs I applied to and how many programs I interview at. And Ray's right, you learn a lot about yourself throughout interview season. I thought fourth year would be so fun. It'd be great. It was like the most terrible year ever because there was so much self-discovery happening. And I was like, I hate this. Like, I can't believe I have to think about like truly, truly think about like where I want to be and what I want to do with in life and how important is it to me to be near family. For whatever reason, I had so many, I thought I was gonna be like the Hallmark girl, like Midwest girl, moves to a big city, had so many New York City interviews, including Kings County, which I was like so excited for. I'm like this is the most badass program ever. And I was terrified, Sean. I was like, oh my God, they work too hard. I'm gonna die. So I think there is like definitely, I will say like you're gonna go into interview season with expectations, and a lot of them will be flipped on their head because you're going to learn about yourself and you're going to, go into some interviews expecting you're going to love them and you won't. And you'll go into other interviews thinking like, okay, like I think I'll give this program a chance and you'll love it. You might rank it first. So keep an open mind, but at the same time, don't exhaust yourself. Your time is a limited resource. And there is something to be said about like not hoarding interviews because, other people want interviews too. And I don't know, we're all nice people and want to share.
Thank you so much for that. You guys are giving us amazing answers. I'm going to pass it off now to Jay.
So another question I received in the chat just now was thoughts about EM possibly moving on from ERAS. So I'm presuming that they were discussing like another application tool like Residency Cast or something to that effect. I'm not exactly sure.
Dr. Vaughn, do you know anything about that?
There are talks of that, but honestly, it's in the very early stages, so I wouldn't stress out about that right now. And I guess just focusing, I guess, on this season and the next season, if that does happen, it's probably not going to happen for like the next 3 to 4 years. It's definitely long down the road. It takes many years for things to become that concrete and happen, and we have to ooh and ah and talk about them for a long time before we integrate them. So I don't foresee that coming. Within the next 3 to 4 years.
Okay, cool. And then the next question that I see in the chat as well is, what are some good questions to ask program directors when you do see them in interviews?
Is the question specifically for the program director or for residents, or which one was it? Sorry.
It looks like they were specifying it towards program directors.
I think it was very important for me to ask the question of what is the response of this program to the medical violence happening in Palestine? That was very close to my heart at the time, and that has honestly changed the rest of my life and changed what I want to do with the rest of my life. A lot of program directors did not necessarily give me the answer that I wanted, but just asking that question out loud, I would get DMs from residents or from, faculty or whatever. And I think that was very instrumental in helping me assess the types of programs that would accept me for me and accept me for the things I care about versus the type of programs that are like, we don't talk about politics, we don't talk about anything, which, I personally find ridiculous because medicine is politics, medicine is racist, medicine is very much entrenched in these systems of oppression, and I want to talk about that stuff.
For me personally, asking questions about community initiatives was something big for me. That's one of my passions. So I think just the overall theme of this question is you should really find what your passion is, and then gear that towards asking the program director specifically that. Don't just say just a generic question that doesn't really have much like passion behind it. There was a reason why you wanted to be an EM doc. There's a reason why you wanted to apply for this specific program. So pretty much find that specific question, or that general theme of questions, and that's the question that you should ask the program director.
I agree. I definitely, like I kind of mentioned before and was just talked about, I asked a hard question. So I wanted to know like what different programs are doing for their DEI curriculum, especially in states where maybe it's a little trickier. So that was a question I always ask program directors because that was important to me. And then one question I really liked asking as well was what's one thing in the program they're most proud of? I think that was a question that I got asked a lot on my application. So it was kind of interesting to kind of flip it and see, what the program directors are most proud of within their program, and how they see the program growing over the next few years, because that's something that if you become a resident there will directly affect you. And so it's kind of nice to kind of see the trajectory and what they hope for in the near future.
Yeah, I think I asked pretty much most of the same questions. I also made sure to ask like how do they receive like resident feedback, and what was one of the most recent feedbacks that they've gotten that they've made changes on, and ask them to explain it, just to see are they, when they receive this feedback, are they actually doing actionable things that really will make an impact towards resident well-being, their wellness. I think that's something that's I'm really big on. So asking those questions for sure.
Thank you guys so much. That was very in-depth. I think that question was well answered. I do appreciate all of you. So our next question is, how should I follow up after the interview? Email or a thank you card? What would you suggest? Should you put your own personal spin on things?
I guess I was a bad applicant because I personally didn't email. I was advised not to, and I'm just gonna listen to what I'm gonna be advised to. If it's not broke, please don't try to fix it. I think the program directors and APDs and residents get so many emails. So I would say just leave everything on the court on that interview. Say everything that you need to say, and just rank appropriately, and everything will work out. But that's just the advice that I personally want.
Yeah, I think it's really up to you. I also personally did not send thank you notes or emails after my interviews. I think that was kind of similar advice and just like personal decision. I didn't feel like it was going to do a lot other than maybe overwhelm PDs and APDs that have a ton going on already. But I don't think it's a wrong thing to do either. So I think it's really what you feel most comfortable with. I don't know if Dr. Vaughn has a different opinion, but I didn't personally do it, but I know people that did. I don't know if it helps or hurts you either way.
I think only time I sent emails was if we had a really great conversation and it was going to be something where I wanted to seek mentorship, even if I didn't match at that spot. And I'm big on building connections, big on like building my village. So for me, if I felt like there was great vibes and they would be great mentors down the road in EM, that was the only time like I sent an email and like genuinely thanked them. Like, for everything that they gave and poured into me in that interview. That's the only time I did that. So yeah, just listen to whatever they say. Because a lot of times in the interview, at the very last 5 minutes, they're like, "Thank you guys for coming. Like, please don't feel pressure to send me an email. Like, you don't need to send an email." If they say that, just listen. I think that's the time that they're like, "Don't send an email." Like, yeah.
Yeah, all these are great answers. The only thing I'll say, because there really isn't a one way to do it, I would just say that if you are going to reach out, don't have it be something, personal to that conversation. Don't just reach out for the sake of just like sending a blanket email that I can tell that you sent to everybody else. Make sure that, you might put in or take some notes about the conversation that we had and say, oh, I love or appreciate the fact that, well, not necessarily that I love, but I remember the fact of us talking about this and I really appreciated that conversation, or I really appreciated, or you taking the time to discuss this curriculum with me or answering my questions about this. It may seem small, but, you don't want it to seem like it's just something that you're doing for the sake of doing it. So I would just say like reach out with the most like genuine intention. And if not, then it's safe. Like programs are not going to like negatively or rank you down if you do not send a thank you note. So don't feel like it's the be all end all and that you have to.
Okay, yeah, great insight from everybody. And then along the same line of questioning, how can someone show interest in a program virtually, especially nowadays with most EM interviews being over Zoom and like just that general push for all programs, just doing Zoom calls in terms of interviews as well as like socials and things of that nature?
I can start on this one. I think going to the pre-interview social, if there is one, is important. I think, at least for our program, that speaks a lot to interest. If people, if someone can't make it and they like email us ahead of time and let us know, then that's one thing. But if people just don't show up, to us, it's a little bit, no, I wouldn't say a red flag, but we don't like, we want to see people that are interested in getting to know the residents and getting to know the program. And so the pre-interview social is for you as an applicant, but it's also a way for you to get to know us and know the program. And so I think it's important to show up to that if you're able to and you're really interested in a program. And then also just coming prepared to the interview, having questions, looking up the program ahead of time, having questions specific to the program, I think shows interest as well.
I really utilized residents. I would, choose the residents. Like first of all, like I didn't reach out to a lot of people. I was really intentional with my energy, but the programs that I really cared about, I was I chose residents from those programs, and I reached out to them. I was like, okay, like, can I be real with you? These are the things I care about. These are the things that, I'm looking forward to in a program. Like, what is the rundown? And now as a resident being on that side of thing, I'm like very much I'm very honest with people. I'm like, yeah, like I love this program. I chose it as my number one, but like these are the things that I kind of hate. And you will find things about any program that you kind of hate. And if you're okay with those red flags, then like this is a place for you. But like otherwise, I want each and every one of you to end up in the place that's best for you. I don't care if you end up at my program or a different program. I just want you to be what's best for you.
All right, that sounds good. Thank you,
I'm
guys.
sorry, can I say one thing before we move on?
Absolutely.
Be careful in the setting of Zoom about body language. That's something that I think that we don't talk about a lot when we talk about like practicing interviewing skills and like doing those over Zoom. So if you can definitely practice, I know it seems kind of weird, but practice your interview. Definitely be mindful. I know I have a very monotone voice, so when I'm trying to like show interest, I may try to put more inflection in my voice. So like during the interview show that engagement. And so I think it's really important to just be mindful of if you have things that are in the room, like not looking off, making sure that you're looking at your camera and making eye contact, not slouching or like looking down or like directing, because I know a lot of things can be nerves. But people are going to perceive that or may perceive that as like disinterest, and you don't want them to negatively perceive that. And it's just so easy to do on Zoom. I just wanted to make sure that I discussed that before we move forward because I feel like that's so common and something just for us to all be mindful of.
Absolutely. I think that's a super important point. So thank you so much for bringing that up, Dr. Vaughn. Jay will be stepping out, but we will be continuing. Thank you so much for co-hosting with me. So our next question is, what if I'm the only, let's say, Black woman, Latino, gay, transgender, or Muslim, right, resident at my program? How do I navigate something like that? Should I only apply to diverse programs?
Me personally, I was like, absolutely not. Like, I refuse to be the token anymore. I can't do that. But it's up to you. I think you can find community outside of medicine too. Like, medicine does not have to be your life. But I knew residency would be hard. I was like, I need to find my people. And U Chicago is an incredibly diverse program. They have such wonderful residents. So that's what attracted me to the program. But you have to decide, and also like decide in the context of not just the program, but like the city. Like, are you in, like Kelsey, you talked about this a lot, like what is the political or what is the social context of this area or this part of the country. So it is, I don't think there's a right or wrong answer, but decide like what kind of support do you need and can you find that outside of medicine too?
I think that was a great answer. Anyone else want to chime in? Bree, Sean, who's usually quiet?
I think that's an amazing answer, honestly. I think it is very much individual preference. I think for me, my number one thing that I was looking for a program was a place that I felt like was going to be home. People that I can relate to, people, if things got real, someone was going to have my back. So I wanted a diverse, not only residency class, but I also wanted the staff. I needed mentors that are already attendings, that are full-time faculty, that look like me or that would have my back, that would put me in places that I wouldn't have never thought I could be in to progress in my career. So I think that was something I had to do my own research to see, does this program have the faculty to support my needs? So I personally was very intentional with programs that I had that representation there. But I think it's very much individualized. But it is hard being the only and not having anyone else. It's hard. I'm the only Black female in my intern class. In prior years, we have had more African American residents in their classes, so it's definitely different. But I have amazing uppers. I have an amazing attendings. One of my attendings actually joined on the call to support me. Like things like that. It's the little things, like that's family, that's safe, that's love. So yeah, I think it's very much finding a program that's meant for you.
Shout out to Breeze attending wherever he's at. All right, if no one else has anything to chime in, thank you guys so much for those responses. So our last question before I open it up to the audience is, we know that emergency medicine is a specialty that provides a great work-life balance, right? But it is super stressful, especially dealing with level 1 traumas, depending on where you're training. How do you avoid excessive burnout while on the job? And what are your tips and tricks with that?
I would say just take a break, really. I used to undervalue that so much as an intern. I'm at Kings County. Also, by the way, Amira, I know that you mentioned Kings County and whatnot. I just want to tell everyone we're nice people. It's a great place. All right. But no, honestly, we see a lot. We're a level 1 trauma center in Brooklyn. At the end of any like cardiac arrest or any trauma, whether it be the stab wound, etc. At our institution, we do a very good job with debriefing afterwards, right? So the attendants will grab us, or the senior residents, or even the interns can even really, like start it like, hey, can we talk about this case? Or hey, can we, just walk and talk and just discuss what happened? So next time we could be more equipped, right? So pretty much the theme with this is really taking the time out for yourself. Like, please don't burn yourself out in terms of, if you just witness someone pass away, you don't have to go order some 5-5-Modidine for a person that could be stable for the next 10 minutes. Like, take that 10 minutes for yourself. Know that you need to be 100% yourself to give that to your patients, right? So to answer your question with that, as a PGY2 now, the responsibilities are more there. So I try to tell that to my interns as well as co-residents, but also to implement that within myself. So don't put pressure on yourself. Everything will be all right, but make sure that you're good first.
I think one thing too is just don't forget about your life outside of medicine, your hobbies, your friends, your family, the people in your life that aren't within your medicine family is important. So all the hobbies that you've had in medical school, like don't throw those out the window just because residency gets busy. I think those are ways to like stay grounded. Spending time with family, friends that aren't within your medical community are really important ways to kind of avoid burnout. Moving your body, whether it's walking your dog, getting outside. I think sometimes during my MICU month, especially, or long hours in the hospital, it's kind of nice to just go outside and enjoy the sunshine, or maybe not sunshine, depending on where you're at, but just get outside, get some fresh air. I think those things are all important, and just leaning on your residency community. We're all going through it together. Hopefully you're at a program where you feel supported by your faculty and your co-residents, and I think you can lean on those people a lot. I know our residencies had a few tough cases recently, and we've just all been able to like come together, have like share circles, talk about how those cases have made us feel, and really lean on each other, and I think that helps a lot.
Yeah, my class, we call it pulse checks, and we all say what our pulses are, even if it's ridiculous. Like, I'm in VTAC right now. We will just all laugh about it and just explain and have these like moments where we can just like really explain how we're feeling and really feel supported. And it's in normalizing when we're not okay. I think that's the biggest thing, is not feeling that you're alone and that you can't talk about you not being okay after seeing something really, really bad. And knowing that they're going to support you. They're going to be there to, like have a shoulder to cry on, literally. Like, that is okay. I've definitely had moments where you just need to go to the restroom and just, talk to yourself in the mirror and say, we're going to be okay, 4 more hours. And then after that, we'll revisit how I feel after I get home, and we can kind of go from there. But just remembering that I need to grow every single day. And the only way I'm going to grow is if, I'm going to be uncomfortable, and kind of just get through it. You've learned so much by failing. I think that's something that was hard for me to really understand. Like, do I really have to fail to grow? But you do. Unfortunately, those mistakes that you make, unfortunately, you will never make again. Like, you learn, like, oh, I will never do this one thing again, or I need to do this thing differently. I could catch this diagnosis quicker. And it's uncomfortable, especially intern year. But we're all going through it, and going to a place that's going to support you, so that you're not burnt out, especially intern year when you're questioning, like, did I make the right decision? And is this the right program? Like, really make sure that you're checking in with yourself, because your life is important. So, yeah.
I think medicine can be really beautiful sometimes too. Like, I'm in the PICU right now, and yesterday I just cried in the workroom. It was a rough day for many reasons, and one of the fellows was there, and we talked about life and everything, and it was so funny because after this like very, very like deep, beautiful conversation, like I left, I was like, I don't even know her name. Like, I don't even know this fellow's name. She's not on my team, but like that's just like we all kind of like understand each other in medicine, and I think that lean into that. Yeah.
Perfect. Thank you guys so much for your participation tonight. You have outdone yourselves. Your answers were very thorough, and we do appreciate all the knowledge that you have shared. I do have a couple questions that I saw in the Q&A, but I feel like a few of you answered them already, so thank you so much for doing that. We can take about 1 to 2 questions, opening it up to the chat. Don't be shy and ask your question, show your face. If not, we will just close here, and you guys can put all your information in the chat, just so anyone can follow up.
Thank you everyone for being here, and I hope everyone's interview trail is going well.
All right, looks like no one has any questions. If you do think of anything else, just go ahead and send your emails to each panelist here. Thank you guys so much again for coming out, and we really do hope you appreciated this webinar. Have a great night, everyone.